Welcome to Variations 4. This is the unit on shock, and in this video, we'll be covering question number 20. Number 20 asks us to look at specific strategies for the treatment of shock right out of table 6911. We'll look at 6911 right now. A lot of this should be a summary of the things we've already talked about in this whole unit. In fact, it is. It's a summary grid. Not every point we're going to focus on. So let's just go through and take a quick look at some of the summary stuff that you want to look at. So here we are at table 6911. I'm just going to zoom in here a little bit because I appreciate this might be on the projector screen right now. Okay, so we just kind of look at each one here and really nicely sectioned out. Cardiogenic shock, oxygenation. I mean, you do not need to know all these details about SVO2. This is getting a little beyond us, but you know, with cardiogenic shock, it's really just good to think about kind of what we talked about when we talked about, for example, MONA in the cardiovascular unit, where we said that, you know, once you get them up to 95%, you're probably happy. Anything below that, you're definitely reaching out for some oxygen therapy unless otherwise ordered. Circulation, I mean, it just depends what's going on, like what's causing the cardiogenic shock. Let's just use one example. For example, do they need angioplasty? Are we cleaning out a cardiac cardio artery? Do they have like CAD disease? They need some plaques cleaned out of their cardiac arteries. So that's just one of many examples. This could be anything in here. What do we need to do to restore circulation? What is the problem with the heart? Can we fix it? What's the problem with the blood vessels? Can we fix it? And drug therapies we've kind of talked about already. We're not going to go into any more detail than what we've said so far. All right, so then moving on to hypovolemic shock. Again, O2 as needed. It's a general summary of what we already talked about with fluid replacement. You don't need to know CVP and PaOP. That's beyond you. Correct the cause, of course. We move on to septic shock. You know, and really if we can whatever's needed. I mean, they might need mechanical ventilation. It depends what kind of shape they're in right now. We talked about fluid management already in the last question. Of course, we talked about these meds here, the need for the, you know, depending on what's going on with clotting and balancing that with DIC and what's going on with needing blood pressure increased and what's happening with the heart, what's happening with antibiotics. We've talked about these types of things. Blood cultures, temperature, blood glucose, stress ulcer prevention. I mean, this all ties in with things we've talked about generally and within this unit. Neurogenic shock, I mean, it depends what they need. Do they need intubation? It depends what kind of shape they're in here. Be cautious of the fluids. You already talked about that. Maybe they need vasopressors. Maybe you need to give a drug to increase the heart rate, something like atropine. Watch out for your spinal cord trauma. Monitoring temperature, because remember from the neurological unit, these could be cold or hot and not be able to let us know. They may not know themselves. Finally, we're talking about must be anaphylaxis. And of course, airways always, oxygen. This is your basic ABC stuff. Yes, we might need fluid therapy, your antihistamines, your bronchodilators, you know, your corticosteroids to combat the inflammatory response. Epinephrine we talked about in the unit. And, you know, don't re-expose them to the allergen.